Welcome back to the Healthy Commute. I'm Dr. Dan with Dr. Pascal. Today we're going to talk about lower back pain.
Lower back
like
pain.
I was just making fun of there, that's something that we rarely see in our office, which is obviously extremely sarcastic. It's something that is something we see a lot.
Tons, prevalent.
Yeah.
I mean, we know stats, the National Institute of Health has shown us that 80% of adults are going to suffer from low back pain at some point in their life. So 8 out of 10 people are going to be afflicted with it, right? So that's pretty common.
Yes,
it's pretty common.
The effect also of lower back pain on the workforce. It's the #1 cause of disability worldwide.
Yeah.
So when you think of people not being able to work or on WCB claims following an injury, that they're just not able to continue being functional, mostly it's because of lower back pain, and the effect that has on like sick days and the cost associated with that is just astronomical.
And what's crazy, Dr. Dan, is that over the past 10 years, that cost and the number of people being affected has nearly doubled. So, even with the advances in medicine and so on and so forth, the reality is what we're currently doing to try and address this is not working, right? Because this problem is getting worse. And so we need to take more drastic measures and have people understand at the root level, why is this happening and what do we need to do to fix it?
Right. Yeah. And maybe to clarify, the traditional approaches
Correct.
to lower back pain is not working.
I don't want to say opioids only, but,
Right.
but taking medications to mask it
Yes.
and taking anti-inflammatories is not solving the problem, it's simply masking the symptoms, and it's not getting to the root cause of why people are having low back pain and solving really the problem at the core.
So let's start from the top if we can.
Yeah.
So what would cause, let's say, lower back pain in the first place?
Wow, that's a great question. And I think, if we want to do a quick grade 10 anatomy review, there are a number of structures that really make up what's called the low back. There's the spine, and then the spine itself is made up of numerous bones and ligaments and tendons and discs. Then there are the muscles on the side of the spine that can be causing problems. And then there are also inside the organs, inside the body, that could cause or mimic low back pain, right? If someone has an infection in their abdomen or in their colon, they could have low back pain. If someone had a tumor growing, they could have low back pain, right? But those are the kinds of things that are very, very, very rare. Most instances of low back pain have to do with the tissues in the spine, okay? And in those cases, it's generally going to be a disc injury, right? Like a herniated disc, so someone wakes up with that 10-on-10 back pain, needs their spouse to help get them out of bed because the day before they tried to lift a 100-pound box and they heard a pop. Or it's this back pain where someone comes in and says, hey doc, I don't know why it's happened, but this is just slowly getting worse over time.
Okay.
Right, or a chronic injury that's been building. It's this non-specific low back pain, meaning it's not one specific thing causing the pain to be there.
And I think maybe to put it maybe in perspective is there's a lot of, let's say, pressures and stresses that we typically go under, right?
Yeah.
We have falls, accidents, injuries, stress, sport injuries. Right now it's slippery outside, so someone may, kind of slip on the way to get to their car. There's a lot of pressures and stresses. But the other thing is also the opposite of that is just being very, very sedentary,
Correct.
not moving, sitting at a desk for 8 hours, then going home and watching, 4 hours of TV or watching your kids' sporting events, and you're just sitting. So there's just lack of mobility that's also causing a lot of stress onto the spine as well.
Right. So those things like sedentary postures, sedentary living, those are considered micro injuries, if you will, to the spine. So there's a lot of pressure on the discs. You're sitting, the spine's not moving properly. It builds scar tissue and improper movement. Then you add a slip and fall, which is a bit bigger trauma to the spine, and you add another little bit of injury or lack of movement to the spine. And so you start adding these things up over time, little injuries with sedentary life, and you're basically filling up a bucket till eventually it spills over, and then your brain decides to tell you, hey, you have low back pain, right? And that's a really key thing to understand from research. What research is really telling us is that you're not feeling pain in your back. It's your brain sending you a warning signal telling you that there might be a problem in the low back.
Right.
That's
so you feel pain in your brain.
Correct.
Not in the joint or in the lower back or the knee or the shoulder. It's your brain is where you're feeling the pain.
That's right. Your brain decided to tell you that it's a good idea for you to feel pain so you can go get it checked out.
So why would my brain, if it's on my side, why would my brain kind of cause me pain?
Well, it's just like the check engine light in your car. The check engine light goes on if it detects something could be wrong to prevent what? Further damage, right? So it's telling you now you should go get this checked because something isn't going right and you need to get it checked to make sure it doesn't get worse and then to also fix it or reverse the problem.
And just like you mentioned, like that check engine light, and I guess it's always the good analogy because even in a car, if there's either too much of something or not enough of something, it wants to let you know.
Correct.
Because in those situations, that's when it's primed to break down.
Correct.
So same thing for your body. If there's either too much tension, not enough tension, too much movement, not enough movement, it's creating an environment for future breakdown and damage.
Correct.
And unfortunately, in those scenarios, it's already affecting the communication between the brain and the body. So now if we're already being, I guess, compromised, then the brain then can't properly send the right signals or help which muscle should I activate so that I don't create more injury. So now we're already behind the eight ball.
Correct.
So a lot of times where we have to understand is when a patient finally walks into our office, it's very rarely something that was just happened, even if the fall just happened. It's usually a massive combination from time.
Correct. And so what we also need to understand is how your brain is perceiving that pain. So remember, brain perceiving the pain is informative. It's there to tell you something. So your brain can understand that there might be tissue damage. The amount of pain is not proportional to how much damage is there.
Right.
Because we've seen it where people come in and they have excruciating pain and there's only a little bit of damage. And you've seen the opposite end of the scale when we sometimes take x-rays and there is a massive amount of damage to the spine and people virtually say, hey doc, my pain started last week. Right? So we have to understand when you come in too, if you're feeling pain, you can't associate or assume that just because you have pain that there's a lot of tissue damage there. Right? And so part of our job is to find out, okay, is there tissue damage? What level of tissue damage is there, and then what's the best line of approach to fix that tissue damage and or the root cause of the problem, not only now, but long term so that problem doesn't come back.
And that probably leads to a very common question that people might have, right? And I think some patients may be even a little apprehensive because they're like, well, I don't want to walk into an office and then have whoever it is, let's say, start jumping on my spine or pulling on this or doing this.
Just like YouTube videos.
Just like YouTube videos and Dr. Google, right?
That's right.
So what would a typical patient expect when they walk in for their first appointment in the office?
Okay, so regardless of the situation, whether you have back pain, no back pain, you're coming in because you want to get your spine checked, either before a problem happens or if there's already a problem. Day one, you're coming in and first thing you do is you sit down and you have a conversation with one of the docs and find out, okay, history. Okay, what has happened in your life? Slips, falls, did you play football for 12 years? Because, that could be important. Did you do mixed martial arts? Did you have 6 car accidents? How long have you been sitting at a desk for? So we find out what kind of big injuries and little injuries have happened to your body, your spine, over time, right? And then we also will look at things like your posture, because your posture is going to tell us a lot about where the injuries are to the spine. So we do an exam, we create some motion, see where the spine is stuck, not moving, where the posture is off, and then from there we can determine are x-rays required to further assess and diagnose this spinal condition or spinal breakdown and determine how bad the tissue damage is, what it's going to take to fix it, and how long that would take.
Right, and I think that's where, for us, we get the most amount of, let's say, information, knowledge, and understand what now is the best thing to move forward.
Correct.
And the second part, I think, is one of the most important parts for that patient is now to review that information.
Correct.
Right? So now they come back in another day, and that's when we get to sit down and explain the x-rays, where the problems are, where the curves in the spine are maybe not where they should be, or putting more pressure and stress, or what's causing that lower back pain or that neck pain or that headache or those problems that you may be having. And then also now what could we do to either slow down that breakdown or start to correct and change that spine so that not only can you feel better, but we could stop further damage from continuing and get you as healthy as we possibly can.
Yeah. So just as a recap, our first visit with any patient is really just an in-depth exam and consultation for us to gather information about that person, what's happened to them, what's going on with their spine, and what's causing their problems, right? And then we sit down the next day with them, and then we'll show them exactly what's happened on their x-rays. We review all that information with them so that they can make an informed decision. They can understand their condition and then better understand how to, yes, like you said, not only fix this, stop this now, but then learn the processes long term to prevent this problem from getting worse.
And I think this is where, to me, this is really where the magic happens, right? Where the patients truly understand what's going on. And this is where, to me, people get better that much faster when now they are understanding what's going on,
Correct.
What they may be doing that was causing the issues, and what they could do to change so that they could be getting better that much faster. And that's where also over those next few weeks, we also want to say, okay, what kind of stretches, exercises, movements, changes
Correct.
to your
diet.
office setup, your diet, your exercise, your sleep positions, all these things that also play a role in helping you, again, get better faster.
Yeah, because there's really, when we're helping a patient out, we're adjusting them in the office here. So we're helping primarily that brain communicate better with the spine, because the vast majority of spinal problems, right, unless it's that specific disc herniation that happened yesterday because of that heavy lift, other than that, it's non-specific musculoskeletal pain, and the main cause there is breakdown between the spine and brain communication. Right. So our job as chiropractors with adjustments is to make that spine move properly again so the brain and the spine can communicate properly to shut down the pain pathway. Right? But on top of that, then like you mentioned, we add a few things. We teach you about ergonomics, we teach you proper spinal movement and rehab patterns at home. We do nutritional consultations, and then as much as we can help people with mindfulness and help reduce stress, because we obviously live in a very stressful and anxious world in these days. So the more we can help people keep that quiet mind, the better the results are long term.
Absolutely.
So that's really our approach.
And maybe a last thing to touch on is I obviously seeing the results, I know how chiropractic helps someone and how quickly it can help someone. But really the latest research also says a lot in terms of the cost effectiveness of chiropractic, the effectiveness in terms of speed of recovery. So maybe talk about that a little bit.
And what's really interesting, so we were listening to those, they're basically like research reviews. So it's not just a research project, it's scientists that will go out there and they'll review research from the previous 9 years. So a very long time. And they're gonna look at all of this research from different insurance companies and different insurance providers, and they're gonna look at, okay, so all these people that suffered back pain over the past 9 years, how long did it take them to get well? How safe was the intervention? What did it cost? And so on and so forth. How effective was it? And what is mind-blowing is when we look at that research over time, it shows that chiropractic is as effective, if not more effective, than any other quote-unquote treatment for low back pain out there. But what is the best part about it is that it's about half of the cost of the other interventions, right? Half, if not even less than half of the cost of traditional care, such as, going to the medical doctor to take pharmaceuticals, or, what we would say like the watch and wait approach, like learn about these postures and watch it and hopefully it doesn't get worse, or physical therapy. So cost effective wise, we are bar none the most affordable for the patient. And what's really interesting too is those that saw chiropractors had the fewest days off of work, so we had the quickest return to work and the best long-term results. So
all in all, I think it's I think people should go and take a look at chiropractic and what it could do for them.
Absolutely. And if you need somebody in your area, and you want someone that sort of follows the same path that we do, please reach out to us, and we'd be happy to point you in the right direction. If it's not in our city or another city, so on and so forth, we'd be happy to do that.
Okay, and if you do have lower back pain and you want some help, let's say getting to the bottom or the cause of what's going on, definitely give us a call here at 204-474-1159 or email at info@lindenwoodschiropractic.com. So hopefully that gave you some great tips today, and hopefully again you have a great rest of your healthy commute.